Hey, good afternoon, everybody. It's Chris Smetana with IAMED. I wanted to come in and give you guys a brief introduction to our all-new course, one of the newest IAMED courses out there, just following the heels of the Focus the Inside View course. We now actually have our 100-hour approved IBSC and NREMT refresher. So we kind of wanted to dive into kind of what is included in this course, so that way you guys can understand what you get for your 100 hours. You know, that stale, old, boring recertification refreshers that you guys are used to are gone. The coolest thing I'll say right off the bat is all the information, all the courses, all the collective content that are in the 100-hour refresher are 100%, that is right, 100% revised and renewed every year. Actually, we're doing it on a semi-annual basis. So as the newest literature comes up, the newest content becomes available, we will interject that stuff into the learning path, so that way you always have the most up-to-date clinical content. The other really cool thing is you get access for 2 years. So all the content, the live streams, the standalones, the on-demand courses, the POCUS course, the FMP live course, you get for 2 years. So you really can't beat what you get and the value in this package. But I kind of wanted to walk you guys through. First and foremost, just understand we just did a revamp of the IAMED website, the training site, and we've now added a new navigation bar up top. Along with the back button to make it a little bit more easily navigable. So that way, if you guys need anything, you can also go here and find the courses under the 100-hour refresher as well. So let's kind of get into it. So what do you get for the 100 hours? Say, first off, you get to knock out your NREMT refresher at the same time. So for those of you guys that are FPC or you have your CCP-C, you guys will knock this out and you'll knock out your state and your national recertifications at the exact same time. So there's no doubling down on anything else. You don't need to go anywhere else. You can complete everything 100%. It's online, it's on your time, it's on demand, with the exception of the 4-day live stream. That's the only thing, but that's the cool part because you get to knock out your VILT all in one fell swoop. So you get 45 hours. So we go above and beyond. So you guys asked, we delivered. This is actually the industry's first 100-hour IBSC NREMT refresher that is currently available on the market. So we're really proud of the IAMED team for getting this out. We're also extremely proud and humbled to be working with the CME Collective partners. And those partners are Rebel EM, Heavy Liza Helmet, John Hopkins Lifeline, and the Mid-Atlantic Transport Conference. We also have Echo's Rotor Wash podcast and the new CME Collective, our Med-Inspired podcast, and the Push Dose Medics. So, you know, we're making sure that we have a wide variety of content for our various community and all of our listeners out there. So the one-stop shop for certification, for sure. So what do you get? Let's kind of dive into the meat of this stuff. So you get an official IBSC approved review course. So for those of you who are not familiar, or maybe have not recertified for your first FPC renewal cycle, you actually have to take a 16-hour approved IBSC refresher course. That there are plenty of out there in person and online, but this also includes that built in. So you don't have to really go anywhere else. So it knocks out that 16-hour required approved refresher that's actually built into our 45-hour flight medical provider course that is presented via live stream. So most of it, all of it is online. You have pre-course work. Every day you'll have homework throughout the class. You have quizzes, flip cards, rationales, resources, videos, then you follow up with a post-course. So it is really dialed in. Check out our Facebook reviews for that course. They're phenomenal, and we can't thank everybody for being a part of that. The other thing is you're going to get 30 hours of accredited F5 VILT training. So this meets all of the NCCP national recertification requirements. So you knock out that. It's 100% done with just those 4 days. 15 hours of that accredited meets your NCCP state and local requirements. We will put the caveat out there. Some states accept just CAPC required content like this. Some might actually have special requirements. So please check with your state and local BMIS or Bureau or EMS department to make sure that this course is going to line up with what you need. The other thing that we actually include is 55 hours of accredited F3 distributed learning. So what does that mean? F3 is on demand, okay? It means there's no instructor that's actually presenting the information. So that's where you have the discrepancy between F5, which is virtual instructor-led training, that counts as your in-person hours, and F3, which actually is just on-demand content that you can do at your own pace. And that content is made up of blogs, articles, podcasts, videos. So it's not the same stuff. You get different mediums, so you're always learning. All the POCUS course, the Flight Medical Provider on-demand course, all that's built out and delivered in micro-sized, micro content, you know, bite-sized learning. So that way it's not overwhelming. You guys can do it on your time, on your schedule, so you know what's coming. And the best of all, it provides a learning track. So you know exactly what you need to complete in order to meet that 100 hours. So you don't have to go challenge the FPC exam. Now, some of you out there like myself kind of like doing that. I've done it 3 times and you know, for me, it's what I like to do. For other people, you know, especially those who might be waiting a little bit towards the end, it's really hard to get those 100 hours that are approved by the IBSC. So all of the hours here are 100% approved by the IBSC as approved CEs. So the topics include 75 hours. You have your clinical. Okay, so when you have your IBSC, we'll break it down. You have clinical and you have operational content. You have to have 75 hours of clinical content. And they're very specific about what they do and do not take. So just your basic asthma, asthma courses, your flight or ground academies or initial new hires, you can't use those hours. CPR renewal, CPR initial, PHDLS, you can't use any of those hours. The only cert course or card course you can use to recertify is going to be your NRP or neonatal resuscitation program. That's the only one that they allow you to actually use. Of those 75 hours of clinical content, 16 hours has to be an approved IBSC review course or refresher course. This meets those demands. The 25 hours of operational content can come from various places. We have different operational content. We also have clinical content built in as well. You get certificates that are instantly granted upon completion of each course. So you don't have to wait for the whole 100 hours. As you're knocking out these modules, you get a certificate right away emailed to you and available in your IAMED LMS. Also, it generates a transcript. So you can literally just take that and print it off and upload it to the IBSC's website. You can identify the individual certifications and upload those as well. Just remember that those IBSC recertifications are 100% audited, so you will need to have a certificate for each lesson that you do submit. What else do we get? Well, you get online student support with the IAMED Critical Care team. So you know, anytime you have a question, you hit that support widget. Either you will have a live chat during our chat hours, or you can leave an email and we'll have one of our critical care instructors reply back. So that way you guys are getting the answers to the questions that you guys need clinically. So you guys can continue to improve and grow and elevate your clinical knowledge. So we're always super stoked about that, you know, and having that ability to reach out and get an answer and get that feedback is extremely important for not only customer service, but for you, the student, to learn. You know, we want to make sure that we're meeting that. The other thing that you guys will get in this course is you'll get a copy, an electronic copy of POCUS, the Inside View, our brand new study guide that's now available for our POCUS or point of care ultrasound course. We also include the electronic version of the Flight Medical Provider Study Guide. So you guys don't have to go buy these books. They're available electronically in your course. So you guys already have access to them. So we provide those references and those materials with you. If you guys need the print version, you can obviously go onto Amazon or to our retailer at Cape Cod CPR. And what else do you get? Okay, you get the Flight Medical Provider resources. We got videos, quizzes, exams, flashcards, RSI checklists, you know, ventilator troubleshooting guides, and we're always revising our resources and the content. This material is dynamic. It gets revised every class. I don't think people understand that. So we just ran 2 classes last week. They were great. We were super thankful for Fairfax County Fire and Rescue. They were a phenomenal host, but we also get a lot of good feedback, and we look at every one of those student surveys so we can see how we can improve the program. So it's 100% up to date on pretty much all the clinical care information you guys are going to need to do the job clinically. And we want to make sure that we set you up for success, and we're not sharing information that was last year's information or 2 years ago or 3 years ago. This is current, relative, up-to-date information, and we try to keep it as up-to-date as we possibly can. So, you know, this is one of the powers of this dynamic course. You know, what is the NCCP breakdown? So when you look at what are the requirements I need to hit for my national registry? Well, 30 hours need to come from your state or national component. You have to have 15 hours from your local and state component. Remember, that was the one I talked about a little earlier that I said, hey, just check with your local Bureau of EMS just to make sure that this course is going to be meet those requirements. And if you need to, just email support@iamed.us. We'll send you over a template or an outline of the course to meet to that accrediting body, so we can make sure that hopefully we can get it approved for you. The individual portion, this will cover 15 hours of those. We actually provide 55, so we actually go above and beyond, you know, what's actually required in your state and your national registry refresher. So with the IBSC breakdown, so what is required of you, okay, and what is the requirement from the IBSC? So 75 hours, like I mentioned, has to come from the clinical category. 16 hours of those have to be from an approved refresher course. Both IAMED's on-demand and live stream and in-person courses, so all 3 of those are all approved IBSC 16-hour refresher courses. We actually have just a standalone one. So if you just need just your 16-hour IBSC refresher, Nothing else. We do have a standalone one that just checks that 16-hour box. It includes our flight medical provider study guide, some quizzes, rationales, and some additional learning. So with that, we also have the operational CEs. So this is just operational. Really, you can kind of use anything from bloodborne pathogens to, mental health and awareness and how to, lead and be a leader. So these are all different topics that we've grown into that operational segment. And we're going to be adding more here in the future as we get more content providers that are joining us. We can't wait for IMED Health and Wellness to launch. So what do we get? So let's kind of run through the different milestones you're going to see in the course. So the first milestone you're going to get is you're going to get your FMP live stream. You're going to be able to pick a 4-day live stream session that works for your schedule. That way you can get immersed in the subjects, you can get immersed in the content and get that what is currently happening in critical care transport. The next portion of that section that goes into will be the POCUS course. So while you're waiting for your live stream session, you could be doing the POCUS course that is on demand. It's on your time. Most of these modules are 5 to 10 minutes long. They're bite-sized, micro-sized pieces. They're not here to make you a sonographer, but we're here to basically introduce you to the basics of point-of-care ultrasound. And Dustin and Casey do a phenomenal job with that. Some other things that you get with this, we bring from the content from the CME Collective and our contributors and our partners. So we look at Guns N' Roses, critical care in the hot zone. Okay, this is one of those famous lectures that we saw at Canoga back in 2018. We also look at PTSD and the cognitive video games, whole blood and aeromedical transport, electrical storm, under pressure, acute right ventricular failure, just to name some, breaking the case, nephro no from heavy Liza helmet, the eye and safety, okay, bringing in that operational piece. We're looking at PE emergency, REBOA, going over the REBOA and what is involved in that process, beta blockers, look at kidney injuries, Provider Zero with Shane Turner. That is a phenomenal episode if you haven't watched that one already. Pre-hospital sepsis, Moulin Rouge, Bill Hinckley joining this. So we got Bill Hinckley, Advanced Practice Makes Perfect, Part 1 and Part 2. Some other people we like to be a part of. We got Chris Gibson, Jimmy McSparron, and Chris Sharp from Heavy Liza Helmet and their safety team. Cockpit to Fire Pit, just some discussions about gear and what we need to carry on us for aeromedical transports. 10 things your intensivist wants to know from Dan Rao. So you're getting a bunch of different feedback from different people throughout the industries at different levels. You got flight medics, flight nurses, acute nurse practitioners, physicians. When we get into Rebel EM and some of the content that we have, addressing SALAD, crash and burn resuscitation with Chris Stevenson, the Deep Sharma, when we talk about integrating a pulmonologist and whether or not you want to clamp that too. We got the art of titration when it comes to vasopressors and vasopressor therapy. So we're going in all hands heavy. When I got together with Peter Handheavy, we did some really good ones on pediatric respiratory emergencies, and also, when a child dies, how to provide that that level of not only care but compassion to the family and the friends and the providers on that scene, and afterwards and following. It's an extremely powerful episode. And then we get into Rebel EM stuff. So we have stroke, immobilization of trauma patients, TXA for everything that bleeds, STEMIs, the COAC trials, antibiotics and sepsis, how high flow nasal cannula works. We actually have the 5-part ventilator series as I get down here. Goes over all of mechanical ventilation using Frank Lacerdo, so another industry well-known. We have Cynthia Griffin, Nisa Hathaway is a part of this as well as some of the content. We have the stroke literature review that just came out last year. So this is all stuff that we have that's live, and then some of the CME Collective episodes. So as you can see, the content is deep, and we go into a multitude of different facets when it comes to critical care medicine and just medicine in general. So I hope you guys enjoyed that just basic overview of what the IBSC NREMT Refresher, 100-hour refresher is from IAMED. It's something we're really proud to have out there as another option for you guys to recertify and make it easy. Not only easy, but we want to elevate you. We really want to see your clinical skills and knowledge not only elevate, but we want to have you be able to practice that, pass it along to your patient, and pass it along to your fellow clinicians that work around you. Make the space a better place to be. So with that, I want to say thank you very much for joining on this afternoon. Hopefully you guys enjoyed the information. If you guys have any questions, please hit support@iamed.us. Give us a call at 844-464-2633, or just reach out and leave a comment in this box. We'll be more than happy to help out. Thank you very much. Stay safe and have a great day.